Government is hoping to get 500,000 people vaccinated this weekend. They're especially targeting those that are 50. Let's find out how the process is going in Cape Town. eNCA's Monique Mortlock is at Athlone Stadium, which has been turned into a vaccination centre. Monique, good afternoon. How has the Vooma vaccination campaign been going in Cape Town so far?
It's been quite a busy morning. A little earlier this morning we were at the Beaconville Frail Care Centre in Mitchell's Plain, where at 9 o'clock already we saw a couple of people lining up, queuing there and sitting, waiting to get their jabs. And when we spoke to the site manager at that vaccine centre, Valerie Kruger, she said they were quite surprised that it's so busy, especially for a Sunday morning. Usually people are in church that time of the morning and they'll only start really seeing people coming after 10 or 11. Yesterday they were able to get 223 jabs into arms. I'm now at the Athlone Vaccine Centre at the drive-through part of it. I'm going to ask my colleague Mario just to show you some of the cars that have been coming through. This is also the site where healthcare workers who are part of the eNCA trial can get their J&J booster shot. The Western Cape Health Department have told us that they've been able to vaccinate over 11,000 people just yesterday across the Western Cape. That's 7,672 in the public sector and 4,218 in the private sector. And just this week alone, they've been able to get over 105,000 jabs into arms. So it seems as if, although it's slower than what authorities would like, they are at least seeing people coming into the vaccine centres, although it's still quieter than it was at the start when we saw especially those age groups like your 18 and over coming in their dozens and hundreds actually to vaccine sites like this one to get their jabs.
No, but certainly commendable. Like you say, I mean, it is a Sunday. But what is government there in the Western Cape doing to encourage more people to get jabbed?
Besides bringing these vaccine centres into communities by putting up pop-up vaccine sites, especially in communities like Mitchell's Plain where we were earlier, where they've had quite low vaccine numbers. Besides those pop-up sites, they're also using what they call social mobilizers. And we went on a walkabout with these social mobilizers in Beacon Valley, where they were walking through the streets, just imploring people to come and get their vaccine sites, taking the time to speak to anyone who had any concerns. We saw some people getting stopped by residents asking them, can I get my jab if I don't have an ID? There were also some myths that they were able to bust. Some people saying they heard if they get their vaccine they'll be tracked by the government. And just these social mobilizers, because they come from the community, they know the community members, they are then being used by the Western Cape Health Department just to get that message out there. Let's just take a listen to what one social mobilizer, Fabio Erasmus, had to say about the experience of walking through, because it's not always positive responses that they get from residents.
On a daily basis, yes, we have to go to people's houses that chase us away, but still we try our best to do the best we can to get people to register or vaccinate. They're resilient to take the vaccine. Some people, like the older people, they tell us they're old already, they don't need to take the vaccine. They love their years and stuff like that. So, and we can't force the people to take the vaccine. It's their own choice that they have to take.
That was our reporter Monique Mortlock there. Thank you very much, just giving us an update on the Vooma vaccination drive.